Hey guys, welcome to my channel Learnaway. Today we will going to discuss the Norma Frontalis or the facial view of the skull. So starting from the bones that are seen in the Norma Frontalis are the frontal bone, that is the squamous part of the frontal bone. This flat part is called as the squamous part of the frontal bone that is seen in the Norma Frontalis. The frontal bone is articulating with the nasal bones. These are the two nasal bones that is forming the nason or the internasal suture between the frontal and the nasal bone. Other bone we can see is the nasal bones, the frontal bone, the zygomatic bone. This bone or the alar bone or the zygomatic bone is forming the prominence of a cheek, also present in the Norma frontalis. This part is the maxilla. You can see the suture here is between the maxilla and the zygomatic bones called as the zygomaticomaxillary suture, and this area is the maxillary bone. So the maxillary bone is also taking part in the formation of Norma frontalis by articulating with the zygomatic and the nasal bones. And the mandible bone is also seen in the Norma frontalis. So the bones that are forming Norma frontalis are the frontal bone, nasal bone, the maxilla, the mandible, and the zygomatic bone. Also, some apertures we can see here is the number one is the orbital cavity. Here you can see the orbital cavity. The orbital cavity has a roof, floor, and the four walls. So the roof or the margin of the orbital cavity forming the base of the orbital cavity, the apex is going downward. In the fissures, you can find the optic canal that will form the apex of the orbital cavity. The superior part or the supraorbital margin of the orbital cavity is formed from the frontal bone. The medial wall is formed from the lacrimal, ethmoid, and the sphenoid bone. The inferior wall is formed from the zygomatic and the maxillary bone. The lateral wall will be formed from the zygomatic process of the frontal and the frontal process of the zygomatic bone. This part forming the orbital margin, and in the orbital margin the eye and the accessory muscles are located. Here you can see also the two fissures, that are the superior orbital fissure and the inferior orbital fissure, that are present in the wings of sphenoid, and the articulation of the maxilla with the sphenoid bone for the passage of the infraorbital and supraorbital nerve and muscles. The another aperture is the nasal aperture. It is called as the anterior nasal aperture, which is formed from the maxillary bone and the nasal bone. Superiorly, the nasal bone articulate with the maxillary bone on the lateral sides. So this aperture has a septum inside. You can see this is the septum dividing the two nasal cavities. This septum is formed from the nasal bone, ethmoid bone, and the associated bones. And these elevated structures in the nasal aperture is called as the cornea. There are three cornea: the superior, middle, and the inferior cornea. The inferior cornea is coming from the separate bone. So the nasal cavity is formed from the nasal part of the frontal bone and the maxillary bone. Superior to the nasal cavity and between the orbits, we can find a suture. That is the intranasal suture. Between the nasal bone and between the frontal and the nasal bone is the frontonasal suture. The frontonasal suture and the internasal suture meet at a point called as the nason. The nason is an important bony landmark. Superior to the nason, between the two superciliary arches. What are superciliary arches? They are the some elevations that are coming from the supraorbital margin. These elevations are forming the part of eyebrows in the human skeleton. So these are the superciliary arches. Between the superciliary arches and superior to the nason is a depressed area. You can see here in the frontal bone there will be a depressed area, and this depressed area is called as the glabella. That is more prominent in the males. Now, what are the structures that are in the foramens that we see in the orbital cavity or in the Norma frontalis? There will be a notch. You can see here there will be a small notch. This is called as the supraorbital notch, as it is superior to the orbit, called as the supraorbital notch. This foramen is the larger foramen, is called as the infraorbital foramen for the infraorbital nerve and vessels. The maxilla has the zygomatic processes and the alveolar part. The alveolar part is attached or arises at the conical elevations called as the alveolar processes, and these alveolar processes provide attachment for the maxillary teeth. So the maxilla is also taking part in the Norma frontalis. Now this is the mandible, that is the last bone we can see in the Norma frontalis. It has also the alveolar sockets and the body of the mandible and the ramus of mandible. The mandible we have been discussed in the next and separate video. So these are the views that we can see in the Norma frontalis. Thank you for watching our video.